Mr. Smith. My name is Amanda. I'll be your practitioner today.
Nice to meet you.
I'm going to go ahead and do a head, ear, eye, and nose and throat examination on you today. Okay. So as I look at the patient, the head is a normal cephalic, which means it's a normal presentation. There's no obvious deviations from normal. The patient has a nice round head, normal pattern. No deviation in the hair pattern whatsoever. There's no balding. Face is symmetrical. The eyes are set symmetrical. The mouth, there's no drooping and or of the face and or eyes. The ears are symmetrical. Are you having any pain, sir?
No.
Okay. Could you go ahead and tip your head back for me just a little bit? Trachea is nice and midline. No deviations. You don't have any issues with breathing right now?
Nope.
I'm going to go ahead and palpate your skull. I don't feel any lumps, bumps, or bruises. I don't see any masses on the cheeks or the mouth, or I'm feeling on palpating the ears. You don't have any pain during palpation, sir?
No.
Okay. I don't feel any lumps, bumps, or bruises. I'm going to go ahead and feel your lymph nodes now. So I'm going to go ahead and feel for the preauricular, which are here, postauricular, okay, submandibular, submental, supraclavicular, the deep clavicular, the posterior cervical, and the supraclavicular. I'm also going to feel for your tonsils. I don't feel any abnormalities. They're nice and mobile. There's nothing hard. You don't have any tenderness, sir?
No.
I'm going to go ahead and check for your parietal. Any pain in your sinuses, sir?
No.
Frontal sinuses, no pain.
No.
Maxillary sinuses, no pain. I'll go ahead and have you open your mouth for me, sir. I don't see any problems with the mucosa. It's nice and pink. Both sides of the buccal mucosa is pink. Go ahead and stick your tongue out, sir, and wave it back and forth, one side to the other, and lift it up for me. Go ahead and checking for cranial nerve 12. Go ahead and say ah. Stick your tongue out and say ah.
Ah.
Uvula is mobile. Tonsils are 2+, but I don't see any signs of infection. It's nice and pink and moist. The lips are nice and pink and moist. The teeth, I don't see any caries or any discoloration of the teeth. I'm going to go ahead and take a look in your nose. You can tilt your head back for me. Okay, some septal deviation to the left. However, everything's nice and pink. No bogginess, no grayness. Any problems with breathing through your nose at times?
No.
Okay. We're going to go ahead and evaluate the thyroid to make sure there's no bruise present. Just if you just breathe normally, sir. I don't see any swelling. He stated no pain. There's no bruise that I know during auscultation. Nasal septum was clean. Slight deviation to the left. Lips are nice and pink. We're going to go ahead and start evaluating your ears, sir. The size of his ears are normal and symmetric. There's no abnormalities seen, no lumps. We're going to go ahead and try a test called the Weber's test. I'm going to take a tuning fork. I'm going to place it on the top of your head, and you're going to tell me if you can hear it in both ears. Okay?
All right.
Can you hear this in both ears, sir?
Yeah.
Okay, not on one side or the other?
Nope.
Okay. We're going to go ahead and do the Rhines test. So I'm going to go ahead and hit this. I'm going to place it on your maxillary bone to see if you can hear it for me. Once you cannot hear it anymore, please let me know.
I can't hear it anymore.
Can you hear it now?
Yes.
And when can you not hear it?
right now.
Okay, we'll try it on the other side.
I can't hear it now.
Okay, and what about now?
I can hear it.
We're gonna go ahead and do a whisper test. I'm gonna tell you 3 things in your ear and you're just gonna repeat it to me, okay?
1, 2, 4,
Other side.
5, 9, 10.
Perfect. Okay. So I'm gonna go ahead and take a look in your ears. No sign of infection, no redness, no bulging. Tympanic membrane is gray and pearly. Conal light is 7 o'clock. Check your other ear. Tympanic membrane is nice and pearly, gray, no bulging, no redness. Conal light is 5 o'clock. We're going to do your eye exam. Excuse me a moment. His eyes are symmetrical. Okay. If you look up for me, sir. Conjunctiva, both bilaterally pink, right and left. Sclera is nice and white. Upper eyelids. Good distribution of eyelashes. I don't see any shadowing of either eyes. We're going to go ahead and do a couple tests for your eyes. I just need you to take a look straight at the light. We're going to do a corneal reflex test. Just follow my light, sir. We could do the 6 cardinal glaze if you just follow the light, please, sir. Just follow the light, sir. Checking for muscles. Perfect. Pupillary response. 3 in brisk on the left. 3 in brisk on the right. Excuse me. I'm going to go ahead and check your optical disc. So I'm going to look right into your eyes. I need you to take a look right at the light. Red reflex positive. Optic disc is nice and round. Okay, sorry, just went for a second, sir. Opposite eye. Red reflex positive. Optic disc nice and round.